Hi, my name is Camille Cruz, and I'm going to be doing my presentation today on epidemiology. According to the CDC, epidemiology is a study of the distribution and determinants of health-related states and events in specified populations. In addition, it applies to the study of controlling health problems. Research of epidemiology helps the world understand how many people have a disease or disorder, the numbers of those who have had the disease, and how the disease or disorder affects our economy or society. There are many factors used in epidemiology. These include incidence, prevalence, cost of illness, burden of disease, and DALY. Incidence is the number of cases of a disease or disorder in a population over a period of time. Epidemiologists use incidence to determine the mean of the number of new cases in a community and in a population. Prevalence is the number of existing cases of a disease in a population at a given time. Epidemiologists use prevalence to evaluate how often in which people's diseases occur, and they also use it to plan for allocation of resources for the future. Cost of illness is the way of measuring medical and other costs resulting from a specific disease, disorder, or condition. Epidemiologists use cost of illness to measure and compare the economic burdens of disease to society. This helps healthcare decision makers to set up and prioritize healthcare policies and interventions. Burden of disease is the total significance of disease for society beyond the immediate cost of treatment. Epidemiologists use burden of disease to measure years of life lost to ill health, or the difference between total life expectancy and disability-adjusted life expectancy. Burden of disease makes it possible to predict future healthcare needs. DALY stands for Disability Adjusted Life Year. It is a summary measure of the health of a population. One DALY represents 1 year of healthy life and is used to estimate the gap between the current health of a population and an ideal situation in which everybody in that population would live to an old age in full health. Epidemiologists use DALY to help estimate the cost of burden. There are 3 types of diseases that are prevalent to epidemiology. All 3 of these diseases help epidemiologists and determine the state of health in different populations. The 3 types of diseases that are studied are endemic diseases, epidemic diseases, and pandemic diseases. In the next couple slides, I will go into more detail on each of the diseases and how they are used in epidemiology. Endemic diseases, according to the CDC, is the amount of a particular disease that are usually present in a community. This also referred to as the baseline level of disease. It refers to the constant presence of or usual prevalence of a disease or infectious agent in a population within a great geographic area. There is also hyperendemic, which refers to persistent high levels of disease occurrence. Endemic diseases are not always present at high levels. They can also be rare. The most important feature of an endemic disease is that it is always be found in a population. Examples of endemic diseases can include flu, malaria, hepatitis B, syphilis, and HIV. Epidemiologists originally focused on epidemic diseases, but they expanded to address endemic diseases. They study endemic diseases to learn how to manage and control consistent disease within a population. For example, the flu is significantly reduced in the present-day world by obtaining the flu shot once a year. An epidemic disease, according to the CDC, is when the amount of a disease in a community rises above the expected level. It is an increase in the number of cases of a disease above what is normally expected in that population in that area. There are a few important terms associated with epidemics, which are outbreaks and clusters. An outbreak is the same as an epidemic, however, it refers to a more limited geographical area. A cluster refers to an aggregation of cases grouped in place and time that are suspected to be greater than the number expected, even though the expected number may not be known. The cause of an epidemic is when the agent or susceptible host are present in adequate numbers, and the agent can be effectively conveyed from a source to the susceptible hosts. Epidemics can also result from recent increases in amount or virulence of an agent. The recent introduction of an agent where it has not been before, enhanced mode of transmission, change in susceptibility, and factors that increase host exposure through new portals of entry. Epidemics can be infectious agents or non-infectious diseases. Epidemiologists study epidemics to learn how to control them when they happen and how to learn to prevent those diseases and reduce the number of cases. Epidemics are classified by how they spread through a population. This includes a common source, propagated, mixed, or other forms. A common source is when a group of people are all exposed to an infectious agent or toxin from the same source. A point source outbreak is when a group is exposed over a brief period of time, so everyone becomes ill in one incubation period. A propagated outbreak results from transmission from one person to another person. The transmission is usually direct contact. Outbreaks usually occur over more than one incubation period. Some examples of epidemics are yellow fever, smallpox, measles, and polio. A pandemic disease is a disease that is prevalent over a whole country or the whole world. This is different from an endemic or an epidemic because it affects a wider geographical area, infects a greater number of people than an epidemic, is often caused by a new virus or a strain of a virus that has not circulated among people for a long time, causes much higher numbers of death than epidemics, often creates social disruption, economic loss, and general hardship. Pandemics spread over how easily a condition is transmitted from one person to the next, and the movement of people because infections can be brought to new parts of the world within hours. Epidemiologists use the studies of previous pandemics to learn how to deal with arising pandemics. For example, with COVID-19, almost our whole society and economy shut down. Everybody was in quarantine to prevent the spread of the virus. Many people were not able to go to work or go to the store. Many items in stores were sold out, and due to not being able to work for those who could not work from home, many people were financially burdened. The government helped in many ways, like the economic impact payments, mortgage relief, and unemployment benefits. Other examples of pandemics include the swine flu in 2009, the first appearance of HIV and AIDS in 1981, the Spanish flu in 1918, and the Black Death in the 1300s. Epidemiologists have come a long way from past pandemics, and they know how to control, treat, and prevent the spread of disease over a population. To summarize my presentation, we covered the following. Epidemiology is the study of the distribution and determinants of health-related states and events in specific populations. Factors that epidemiologists use to study diseases are incidence, prevalence, cost of illness, burden of disease, and DALY. The three types of diseases epidemiologists study are endemic diseases, epidemic diseases, and pandemic diseases. An endemic disease is a disease that is consistent in a population. An epidemic disease is a disease that rises above the expected level in a community, and a pandemic disease is a disease that is prevalent over the whole country or the world. Epidemiologists use the study of these diseases to learn from the past and learn how to control and prevent the diseases in the future. These are the references I used to construct my presentation, and I hope you enjoyed.